Hello friends. Today I am speaking in English. I was using Malayalam as my language in all my previous videos, and I think many of my viewers, Malayali viewers, most of them will understand simple English, and I am not very fluent in English also, but I am trying to explain some ideas in English for the benefit of non-Malayalis. Many non-Malayalis were asking me to translate my previous videos in English, but I find it very difficult for me to translate all the videos. So I am trying only one video in English for non-Malayalis and also for Malayalis, for my dear friends. Today my subject is regarding what kind of exercise should be done mainly for diabetic patients. I think in many of our families, a lot of diabetic patients are there. Nowadays, young people also are becoming diabetic patients. But most of the diabetic patients are, I think, above 40-50 years. I am speaking this subject not from my imagination or by reading or any books or something. It is really, I am telling you from my past experience by giving training for a lot of diabetic patients in my gym. My gym is in Angamali, Kerala. The name of the gym is Lee Hands Gym. There I had many different type of diabetic patients. Most of them were above 50 years and some were above 60 years also. In the previous years, I was giving only some aerobic exercises for them. They had some benefits also. But some were doing some weight training exercises with me. I noticed that they are getting more benefits, and many of them told me that I have left one-time insulin intake. So I tried it in many others also, from the experience they have told me. It was wonderful result I was seeing. When they were doing weight training, when the muscle mass is increasing, they are able to get rid of taking insulin. I noticed this for many years and I found this truth. Now recently I read many messages from Google in that the American Diabetic Association is recommending minimum 2-3 days every week weight training, resistance exercises. They are saying the same thing what I have experienced from my past. What happens when you are doing bodybuilding exercises? When I say bodybuilding, most of the people will imagine that it's making big muscles and huge muscles, taking a lot of heavy weights and taking steroids, taking protein powders and like that. But I am saying that is not the bodybuilding. That is not the real bodybuilding. Is building your muscles in whatever your stage is at present, making it better than the present time. For that, no need of taking heavy weights and no need of weightlifting at all. You have to learn how to work out your each and every muscles in your body. There are lots of small and big muscles in your body. The biggest muscle is thigh muscles, and then chest muscles, then back muscles, shoulders, biceps, triceps. I'm suggesting every muscle should be worked for the diabetic patients. It should be worked repeatedly, just like bodybuilders are doing. So what happens in your body? The total muscle mass is increasing every day. Day by day, the total muscle mass in your body is increasing. It is not becoming very huge and very shaped immediately. Muscle is very minute fibers that is forming each and every workout within next 24 hours. When you're doing, many people I know that most of the diabetic patients, they are doing only walking or cycling or some aerobic exercises. What happens when you're doing aerobic exercises? Maybe for 1 hour or 1.5 hours. Your body is working for that particular time only. You are not getting any increase in your muscles. But when you are doing this resistance exercise or bodybuilding exercise, you are doing for maybe half hour or 1 hour. That 1 hour, your muscle is working very hard and more sugar is consumed from your body, your blood. But the next that time only the muscle is crushed and the muscle is built. When you do that particular muscle work, what happens in your body? The muscle is going to be recovered in next 24 hours. So the muscle work is going on in continuously in next 24 hours. So that means your body is working next 24 hours. So your body is taking sugar from your blood next 24 hours. So what happens? It is just like you are doing aerobics in 24 hours. When the muscle mass is increased, automatically what happens? The metabolic system of your body is becoming stronger. It is improving. So when the metabolic system is improving, your body is consuming more sugar or glucose from your body, and there is no surplus sugar in your body. So the fat level, formation of fat is decreasing. Fat level will be decreased. So the need of insulin to store sugar in your fat is decreasing. The intake of insulin can be reduced. So I am suggesting the diabetic patients try to increase the level of muscle strength by doing each and every particular exercises for the particular muscles. So within a short time, you will feel very strong, and the symptoms of diabetic disease will be decreased in your body. In addition to this, your bone mass is increased. The production of testosterone in your body is increased. The growth hormone level is increased. So the whole body is becoming young and it is becoming very healthy also. The weight level, the capacity of the weight taken by each and everyone will be varied. I'm not suggesting everyone should take heavy weights. Maybe you need not take any iron weights also. If you are weak and aged, you can try it with water bottles or with light weights. Some household articles, that's enough for starting people. Gradually, when the muscle fibers are increasing in your particular joints, the capacity of your weight lifting will be increased. So you would be able to lift more weights, and the muscle mass will be increased gradually. So then automatically fat level is decreased, and the surplus sugar is decreased, and the need of insulin is decreased. Now this is the same thing the American the same thing only the American Diabetic Association now teaching to people. I'm trying it with my clients for the last many years, and really they have improved very much. There may be different opinions. I'm not compelling everybody to do this weight training. You can consult your doctors also. But the truth is that people are afraid of taking weights when they are becoming aged or when they are becoming diabetic patients. But from my experience and my studies, it is the truth. I have found that the best exercise for diabetic patients is muscle building, weight training, resistance exercise. And if you are not able to identify each and every exercise for each and every muscles, I suggest to consult some gym trainers nearby your house. Many are there, they know that each muscle should be worked in such a way for improving the capacity. I have uploaded many videos in my channel, this channel also, with household articles for those who are not able to go to gym. I'm saying this is not only for gents. Actually, this type of exercises are supposed to be done both men and women, aged also, according to their capacity. One more thing I wanted to tell you that many of the diabetic patients, they used to tell me that this disease they inherited from their parents. But I have watched that our grandparents, if they were doing hard works for livelihood, even though they had diabetic disease, they had no symptoms of diabetic. They had no problem. They were not taking insulin, but they were healthy also, because they were doing this type of muscle work for each and every day for their livelihood. They had to do this type of exercises by lifting many things, and mainly they were doing muscle work, not aerobic exercises. So they had no symptom of, even though they were diabetic patients, they had no health problem of diabetics. Nowadays, people are keeping their body idle, and they are doing some computer work or office work and sitting in shops, and there is no muscle work. The muscle mass is decreasing, and gradually the fat level is increasing, and the blood sugar level is very high, and the pancreas is getting damaged. I used to tell my clients that your muscle is the second pancreas in your body, because their pancreas is almost damaged when they become acute diabetic patients. But still, they are able to build muscles. They are able to live healthy without the help of pancreas. That means more muscle is there, then the less need of pancreas. That's why I told muscle is the second pancreas. For the authenticity of my words, you can check the description of this video, and you can find out my experiences in bodybuilding, and also in a different game, weightlifting in world level. So I am concluding hereby. Goodbye.